Uh, we welcome you all on PCJ TV online. And today we are so privileged to have the blood bank here, this institute in Uganda, which is in charge of blood donation. And at PCJ, we are so glad that our students, they have engaged in blood donating. And today, we are so very happy that we are also donating to those people so as to save life, because their motto is donate blood, save life. And today we are privileged to have one of the doctors who are with us here, is none other than Dr. Ronald. We want to ask him some questions to see how this blood donating is relevant to us, how is it important, how does it help. You're most welcome here to PCJ.
Thank you very much.
I would like to ask you, the people, all our viewers there, to know you, who you are, where you're from, and what you're doing here.
Well. Thank you, our viewers. We are happy to be here today at PCJ Ginger, and they have been inviting us for blood donation, and really they have saved lives. And being fathers, whatever you get from here, it is very important to our patients. So we have actually we don't have discards from this place, and I must thank you for that.
Oh yeah,
and thank you for honoring our request. Whenever we request, you allow us to.
And we are so much also privileged. So where are you coming from specifically, apart from knowing that you do with blood donating? Where are you coming from specifically?
Okay.
Yes, like so your institute, you as the whole group which is here.
This is the Uganda Blood Transfusion Services, known as Uganda Blood Bank, responsible to collect blood from blood donors, and we screen it until it reaches to final consumer, that is the patient. So this team bases in Ginger. We are basing in Ginger Regional Referral Hospital, and we cover the whole of Busoga region. So we handle 12 districts. Yes, sir. So that's where we base, and we approach communities.
So you approach communities wherever you have been called to, or wherever you have even requested to go and they allow you.
Yes.
So I want to know, people are donating blood. And we have got different blood classes, blood groups. Yeah, you know it better, your medical personnel. Blood groups and what have you. Which blood group is most appropriate, most proper?
No, all blood. We need all blood groups, and we need all blood components, because the community or the patients we receive, they are mixed up. We have different types of blood groups. We have A, we have B, we have AB, and O. Maybe we can talk of universal donor and universal recipient. Like if you have blood group O plus or O minus, you're universal donor. You donate to all blood groups. Then AB being a universal recipient, that whoever donates
can receive.
Oh yes. So we need all blood. We don't categorize or segregate. Whoever comes, we really need that unit, and it helps some.
I appreciate that. Yes. Now that you don't segregate from like the blood groups. Now, what do you consider to say that now Colin's blood is worthy to be taken?
Okay.
What do you consider?
Actually, that is the information we normally give when we are giving health education talks to our potential donors. We consider we have steps to follow. We have to screen whether to find out whether you qualify. We have the machine responsible for that. We consider the level of HB. And a man being having 13.5 to 16.5 grams per deciliter, then you qualify, so long as you are in that bracket. Then for females, it is 12.5 and above. So when you come to us, physical appearance matters, okay? Then there is a history we're supposed to take.
Physical appearance.
Yeah, physical appearance. Because because we consider weight. So via that, we are supposed to clean. So after we take a sample, we see whether you qualify. So if you are in that bracket, then you are able to donate. But you must be not on medication. You're not sick. Operation. So those are the history that we take. Means for someone to donate blood, you must be free from any kind of disease, any kind of those hindrances. Means we want someone who is normal to save someone who is admitted in the hospital.
I see.
Again, a sick person cannot save the fellow sick
The
one.
fellow sick person.
Okay?
Now there is this question has always lingered in people's minds. Can't an HIV person donate to a fellow HIV person?
No.
It cannot be. Okay. So my people who have always been asking that question, please know if you have HIV, just continue taking your drugs, and people will be donating to you. Those ones
That's
who are
why we say
healthy.
donate blood today, save life.
Oh yeah.
Okay, so means when you know HIV is a chronic disease that once you acquire it, you'll have to live with it on treatment. Then time comes, we put you on palliative care so that we prepare you to have a peaceful day.
I see.
Okay.
Okay.
So when you are sick, we have to give you free blood. Yes.
And we talk about saving life, saving life. Who is this person we are saving? Who is this person to benefit from my blood?
Yes, we have very many indications for blood transfusion. Like we have accident victims. If you get an accident and you have profuse bleeding, we rescue you. That first aid we give you first is blood transfusion. Then we have mothers who gives birth and later on they get PPH. We have sickle cell patients. If you are in a crisis, ideally to correct that crisis, you're supposed to get a unit of blood. We have severe malaria, causes severe anemia. Yes, all those ones. Those are the patients who need blood.
So when you're there and you have you got an accident, don't fear. They just visit Nakasero Blood Bank. They can get blood.
But also,
so
you should donate.
You should
so
donate.
that when you come for that unit, at least just have it in your mind that there is someone who donated it.
I was coming to that. We donate blood. And I have to appreciate the fact that you give us soda, you give us biscuits, you give us those ones who take beer. Please, we don't have that. Now, how like apart from getting this simple a drink and a biscuit, how else do I benefit after donating this blood?
Well, donating blood is actually it is a therapeutic treatment.
Oh yeah.
But most people don't know about this. Sometimes you have high HBs that needs to donate some blood. When you donate blood, at least you reduce on these chances of getting cardiovascular diseases. Some feel headache if you have high HB. Some can feel dizziness, hypertension. So when you donate blood, at least you stand the chance of surviving all these conditions.
Oh yeah.
So donating blood is good and healthy. So whoever qualifies to donate blood, so long as you are 17 years and above,
you can donate.
But not beyond 60, 65 years, you can donate. Yes.
Oh yeah. Thank you so much, Dr. Ronald, and we are so humbled to have you here. Our viewers, one thing I have learned today, when you donate blood, you can still get free blood. Because when you have that card, like the one I'm having today, when you have that card, you can just present it to those people. They give you blood. They give a blood to your relative, and you cannot suffer to get blood. So, my dear friends, I also urge you to donate blood for your own future acquiring of blood.
Yes,
so,
Father, there is some other important information maybe to put across.
Yes.
As the Uganda Blood Bank, we have a toll-free line. Like if you have any question, you have any complaint, maybe you have organized a session, you want Blood Bank to visit your organization to donate blood, you can call on this number. This is 0800 122 422. 0800 122 422. So this number is on, you can call on it and you get assisted. And you can also organize, call us, we shall come and get blood. Thank you very much.
Okay, thank you so much, Dr. Ronald. Please call on that number. You get the Nakasero Blood Bank services. They will always come to your rescue. And please, we urge you to donate blood. And today, it has been at PCJ Philosophy Center, Ginger. Students have donated the blood, and we have seen we have learned how important it is to donate blood. Please donate blood, because you are banking for your future survival of life. We